soft presentation. The silhouette cone technology was patented and was developed in 2004 by Al Costa, an American engineer. In October 2006, Silhouette Lift, the permanent device made of polypropylene, obtained a clearance from the US FDA. In 2007, the commercial of Silhouette Lift started and was mainly dedicated to plastic and reconstructive surgery. The CE mark for the other markets was obtained also at the same date. In October 2012, Silhouette Soft, the non-permanent device made of PLGA, was developed as an innovative aesthetic treatment for mid-face reshaping and obtained the CE mark approval the same year. In May 2014, Sinclair Company acquired the Silhouette Lift Company. 5 months later, Silhouette Soft obtained the CE mark approval for the eyebrow and neck treatment. In April 2015, Silhouette Instalift was cleared from the US FDA and launched 4 months later thanks to an alliance with the Thermi company. In 2016, more than 130,000 patients have already been treated with Silhouette Soft worldwide. Made in the US and with more than 11 years expertise, the Silhouette brand is composed of 3 ranges. Silhouette Lift, the permanent device made of polypropylene, which obtained the FDA clearance in 2006 and CE mark in 2007. Silhouette Soft, the absorbable device made of PLLA, which obtained the CE mark approval in 2012. And the last coming, Silhouette Instalift, the other absorbable device made of PLGA, which obtained the FDA clearance in 2015. What is the main difference between Silhouette Soft and Instalift? Silhouette Instalift is entirely made of PLGA, polylactic co-glycolic acid, while Silhouette Soft monofilament is made of PLLA, polylactic acid, and the cones are made of PLGA. The PLGA material is a copolymer of polylactic acid, PLA, and polyglycolic acid, PGA, which have similar chemical structures, 82% of lactic acid and 18% of glycolic acid. The PLGA copolymer is FDA-approved therapeutic material owing to its biodegradability and biocompatibility. Silhouette Soft and Silhouette Instalift can be considered equivalent products, apart from the replacement of 18% of the lactic acid content of the filament in Soft with glycolic acid in Instalift. Let's talk about Silhouette Soft. Silhouette Soft is an innovative bidirectional cone technology device providing safe and highly effective lifting and anchoring. A minimally invasive procedure for face and neck, reshaping by softly lifting tissues to their desired location and stimulating the production of natural collagen. A high-end treatment uniquely building value through high patient satisfaction and practice enhancement. A totally reabsorbable treatment that do not require surgery. This treatment is simply performed under local anesthesia at their doctors. Silhouette Soft is a bidirectional innovative cone technology device made of a central monofilament and cones which face in opposite directions towards the extremity of each monofilament. The cones are evenly spaced either side on the monofilament of a cone-free central zone of 2 cm. Each cone is separated by tied knots and is free-floating between them. On each monofilament there are 2 series of cones, 4, 6 and 8 cones, depending on the device reference. The 8-cone device is presented with 4 cones on each side. The monofilament measures 30 cm, with cones separated by tied knots placed at 5 mm of each other. The 12-cone device is presented with 6 cones on each side. The monofilament measures 27.5 cm, with cones separated by tied knots placed at 8 mm of each other. The 16-cone device is presented with 8 cones on each side. The monofilament measures 26.8 cm, with cones separated by tied knots placed at 8 mm of each other. In order to facilitate its insertion in the tissue, The Silhouette Soft device has two 12cm 23G straight needles attached to each end. Silhouette Soft is a device totally reabsorbable, biocompatible, and biodegradable. The monofilament is made of polylactic acid, PLLA, and the cones are made of polylactic coglycolic acid, has 82% of lactic acid and 18% of glycolic acid. The polylactic acid, PLA, the main component of Silhouette Soft, is a well-known polymer that has been used for many years in a number of biomedical and pharmaceutical applications. It has a long history of use as resorbable device, a drug delivery system, and in surgery, in particular in orthopedic fixation devices such as pins, rods, and screws. It is also a key material in the development of tissue engineering. These applications have been approved for human use by the US FDA. The breakdown process of PLA has been extensively studied. It acts by hydrolyzing ester bonds, while its degradable components are resorbed through the metabolic pathways with the production of lactic acid, which is a naturally occurring substance in the body. PLA is generally well tolerated, and given its synthetic nature, no allergy testing is necessary before subject treatment. Moreover, its excellent safety record after correct implantation has been well documented through extensive clinical experience, and those clinical studies performed involved thousands of subjects. The procedure aims to obtain volume repositioning or skin tightening in any area where the bidirectional Silhouette Soft devices are placed through a process of elevation and compression of facial and neck tissues. The projection of the malar area will improve the midface area in the case of loss of malar volume, while patient with sagging jawline will be given a firmer and more regular contour. The procedure is performed on an outpatient basis and does not require any incision. So, Silhouette Soft offers a redefined face with volume repositioned, long-lasting results, an immediate correction, a painless procedure, with minimal downtime. Once the device is applied subcutaneously, Silhouette Soft provides a dual action, a lifting action for instant results. The focused area is redefined by compressing the tissue and the skin lifted thanks to the bidirectional cones, and a regenerating effect for gradual and natural results. Through the process of reabsorption, the components of Silhouette Soft act by stimulating the fibroblasts and the collagen production. This action, which continues over time, helps increasing the volume and restoring shape of the face. Silhouette Soft is indicated for mid-face skin ptosis, loss of malar volume, jawline ptosis, eyebrow ptosis, neck relaxation. In order to evaluate the laxity and ptosis of the tissues, it is recommended to lift the tissues with your fingers. The patient selection should be very careful, as not all patients can be suitable for a Silhouette Soft treatment. The Silhouette Soft patient must have a good skin quality, not too thin, neither too thick. The following pictures will help you evaluating a good from a bad indication. The ideal indications are midface, jawline, brow and neck, moderate sagging or visible marionette lines and nasolabial folds. The following pictures will help you evaluating the good indication. The patients presented in this slide are not suitable for a Silhouette Soft treatment. Excessive skin in the mandibular region associated with thick skin as PIC 1. Excessive skin due to advanced aging and thin skin. Moderate excessive skin in the mandibular region but with hypertrophic type aging. Excessively thin skin in a face that is lacking fat tissue. Silhouette Soft devices should not be used in case of patient with foreign body sensitivity or known or suspected allergies to implant or instrument materials, in particular plastic, biomaterial. Permanent fillers. Acute and chronic skin diseases. Autoimmune diseases. Pregnancy and breastfeeding. Patients with active sepsis or infection. Patients with limited ability or unwillingness to follow post-treatment recommendations. Patients under 18. There are possible complications as device breakage, temporary entry point dimple, transient hematoma or bruising, skin fold, edema, pain, infection, minimal acute inflammatory tissue reaction, sensory nerve injury, asymmetry and banding, all disappearing within a few days. Thank you for your attention.